AI has quickly become part of our everyday lives, from classrooms to our workplace, now to even mental health support. But experts are raising some red flags about the risk of relying on AI for emotional or even psychological help. We've got Dr. Eileen who's here this morning to explain some of those cautions that we should all keep in mind when it comes to using AI. Good morning.
Good morning, Brianna.
And, you know, I think right now we're encouraging, especially our younger generations, but pretty much everyone, use AI to look that up. Or if you're not sure how to write that, use AI. So mental health, where does that line kind of start?
AI is quickly becoming incorporated into mental health. But the research is showing that amazingly, 50% of people are using AI for psychological services. And it's even more common in the youth. 70% of our youth are saying that they have used AI, and 50% are saying that they use it on a regular basis. But yes, the research is showing that there are significant risks to using AI for psychological support, and that it is not able to replace professional psychotherapy.
Well, that's sort of your first point, right? Because when we think about someone who is in the field of mental health, there's a license, there's schooling, there's all these things that AI doesn't necessarily have.
Yes, competence to provide treatment is very important. Psychotherapy is actually a legally protected term, and it means that you have been licensed as a professional to practice. When you're licensed, that means that you have had to prove that you are following, we have standards of care guidelines that requires training, education, knowledge, experience, and that you have ethical and safe practices with your clients. Chatbots do not have that. They have no guarantees whatsoever, and they have not the education or the experience other than what they've been programmed to do. So it carries with it a lot of risk.
And one of those risks being, of course, that it could lead to some dangerous feedback.
They did a really interesting study at Stanford, and what they found was that across different chatbots, that they used mostly reassurance and affirmation, which is very nice. If you can, I'm not saying it doesn't have a place. If you're doing social support, helping self-esteem, helping people do their homework, doing role-playing, that's great. But if you're dealing with severely depressed people, psychotic people, schizophrenia, hallucinations, delusions, suicidality, this is not going to be effective. In fact, it's been found to make it much worse. So you have to be very careful when you're actually dealing with a severe psychopathology. The computer doesn't have any idea who it's talking to.
Another big consequence, the first one that came to mind, is it might inaccurately diagnose someone.
Yes, which happens very frequently. And the other thing they found in the Stanford study was that it actually was biased, surprisingly. Again, when they went across different programs, they found that there were severe biases against, it was better with mild depression, but it was severely biased against alcohol and substance abuse and schizophrenia. And the problem is, of course, once you get a diagnosis, now that we have all of these programs that go across different medical systems, this diagnosis, which is incorrect, is going to follow you for years and provide you with not only maybe people getting discouraged from getting the proper care they need, but ever getting the right treatment.
We're 45 seconds left. I know there's some privacy concerns and also concerns about cutting off that human relationship.
Yes, there is no privacy, obviously. This information is out in the cloud, and these things are developed by entertainment industries in order for profit, and so people need to recognize there is no security. We are bound by confidentiality, but these things can be out in the public, and children, and especially adults, should know that. And yes, that causes risks to children. There are 2 lawsuits that are currently ongoing because it actually has encouraged people to be aggressive toward parents, to self-harm, and so there's a real risk with doing that.
And you wanted to mention, too, the vast majority are unregulated.
The vast majority of chatbots are unregulated. The American Psychological Association is currently working very hard advocating, trying to get laws to do 3 things: to increase education in children so they understand what they're using, to change the program so that they automatically give you a link to a real professional who is a psychotherapist, and to try and change the frequency and the way that they're being used legally. Yes.
Well, we appreciate this. I think this is a really good one, and parents maybe have this discussion with your children.
I hope so.
Yeah,
I hope
Dr.
so.
Pallas, thank you. Always so insightful. And if you'd like to learn more, from AI to mental health and a number of other things, visit the Center for Sexual Health's website, and we have those additional resources directly to Dr. Pallas on our website. Final check of traffic now.